Bismillahirrahmanirrahim. Start with the name of Allah, the most merciful and beneficial. This is Guli Afshas, a student of base MLT 8th semester, and the topic of my presentation is arboviruses. The outline of my presentation is introduction, definition, classification, history, structure, transmission, pathogenesis, signs and symptoms, complication, lab diagnosis, prevention, treatment, epidemiology. Now it is the introduction of arboviruses. Arboviral is a disease, general term used to describe infection caused by a group of viruses spread to people by bite of infected arthropods, insects such as mosquitoes and ticks. These infection usually occurs during warm weather months when mosquitoes and ticks are active. Now it's the classification of arboviruses. Arboviruses are classified into three groups on the basis of DNA and RNA. Single-stranded positive sense RNA, single-strand negative sense RNA, and double-stranded RNA. Now, what is positive sense RNA? Positive sense RNA is also known as plus sense or sense strand. Positive sense RNA virus consists of viral messenger RNA that can be directly transmitted into protein. Single-stranded negative sense RNA. And now what is a negative sense strand? Negative sense strand is also known as minus strand or anti-sense strand. Negative sense RNA virus consists of viral RNA that is complementary to the viral messenger RNA. Now, single-stranded positive sense RNA contain two families, tegoviridia and flaviviridia. Single-stranded negative sense RNA contains three families, Boniviridia, Boniviridia, Rabiviridia, and Arthomexoviridia. Positive sense RNA single family Rabiviridia. Now I will choose the one of the family from the classification Tegoviridia. Tegoviridia. There are four members of Tegoviridia: alphavirus, robivirus, rubella, pestivirus, artrovirus. The pestivirus and artroviruses are non-pathogenic to humans. Now my further presentation is on rubella virus. Rubella virus. Rubella is a disease caused by rubella virus. It is also called 3 days or German measles. Why it is called German measles? It is called German measles because the disease was first described by German physician Friedrich Hoffmann in the mid-18th century. And now why it is called 3 days measles? The synonym 3 days measles derives from the typical course of rubella eczema. They start initially on the face and neck, spread to the trunk and extremities within 24 hours, then begins to fade on the face and the second day and disappear throughout the body at the end of the day. That is why it is called 3 days measles. History. The teratogenic property of infection was documented by Australian ophthalmologist Norman McMaster-Grech and 1940. What is teratogenic property? Teratogens are substances that may produce physical or functional defects in a human embryo or fetus. The virus was isolated in 1962. The attenuated vaccine was developed in 1967. Congenital rubella syndrome described by Church in 1941. It is the structure of rubella virus. It contains glycoprotein, isosahedral nucleocapsid, RNA single-stranded positive sense, and lipid bilayer membrane. It is also the structure enveloped positive single sense strand or genome isosahedral and shaped lipid capsid structure protein to enveloped proteins. Glycoprotein E1 and E2 is a one core protein. E1 is in the form of surface spike 6 nm long and is responsible hemagglutination and neutralization. What is hemagglutination? Cause clumping of red blood cells which formed a lattice. And what is neutralization? Decrease the replication of virus by blocking attachment to the host cell, preventing penetration of the host cell membrane or interfering with uncoating of virus within the cell. Or the short definition of neutralization: the elimination or reduction of the virus ability to replicate. It does not imply a particular mechanism of interference. E2 glycoprotein is embedded in the envelope. Core protein forms the capsid shell which protects the genomic RNA. This is the microscopic structure of rubella virus. Pathogenesis, respiratory transmission of virus, replication in nasopharynx and regional lymph nodes. Viremia from 5 to 7 days after exposure with spread to tissue placenta, and fetus infected via hematogenous spread during viremia. Congenital rubella. Pathogenesis of rubella syndrome is multifactorial and include the following: non-inflammatory necrosis of chronic epithelium and endothelial cells, which are then transported to the circulation and fetal organs. Intracellular actin assembly is inhibited by rubella function of mitosis and restricted development of precursor cells. Upregulation of cytokines and interference in infected cells, which contribute to the congenital defects. Congenital rubella, when the uh, embryo or fetus affected from the mother during pregnancy. These are the flowchart of pathogenesis. Rubella virus first develops in the nasopharynx, then further it affects the five organs: respiratory tracts, skin, lymph nodes, joints, and placenta. From respiratory tract, when it affects respiratory tract, then its symptom is cough, minor sore throat, skin rashes and lesion, lymph nodes, lymphadenopathy, joints, mild erythrasia and arthritis, placenta fetus, placentitis, infection of placenta, fetal damage. And this is pathophysiology, how the virus transmit from rubella virus first transmit through respiratory droplets, then it infects cells in the upper respiratory tracts, which virus multiplies in the upper respiratory tracts, extend and the regional lymph nodes. Viral reflects and replicates in nasopharynx, infects. Then it infects established in the skin and other tissues, include respiratory tract. Fushes spots may develop, rashes develop, cough, etc. Virus can be bound in the skin, blood, and respiratory tract. Sign. Now it's the sign and symptoms of rubella virus: rashes, low-grade fever, headache, mild pink eyes, redness or swelling of white of the eye, general discomfort, swollen and enlarged lymph nodes, cough, runny nose. Complication. It is a complication of rubella virus: heart problem, losing of hair and eyesight, liver and spleen damage, deafness, mental retardation, encephalitis, microcephaly, and bone defects. Mode of transmission. How the virus transmit: through airborne droplets when infected person cough or sneeze. It can also be spread across the placenta from mother to fetus by direct contact. It can also be transmitted by direct contact. It usually occurs in seasonal pattern during late winter spring incubation period. The incubation period of rubella ranges from 14 to 21 days. Lab diagnosis. Parental fetal diagnosis. And the parental fetal diagnosis is based on the detection of viral genome and amniotic fluid, fetal blood, or cryonic villus biopsies. Postnatal diagnosis: virus isolation, culturing, RT-PCR, serology, diagnosis of acute infection, IgM positive. Antenatal screening test can be done for pregnant women. Prevention: MMR vaccine, and measles, mumps, and rubella vaccine. In Pakistan, only MR vaccines are used. Measles, rubella vaccines. Avoid close contact with anyone who has rubella infection. Use protective clothing, installing door and window screens, and avoiding standing water. Treatment: there is no specific treatment of rubella virus. Antiviral treatment is indicated. Symptom based on the based treatment. Epidemiology. The largest rubella epidemic in the United States occurred in 1964 to 1966 and resulted in the birth of an estimated 3,000 infants with congenital rubella syndrome. Highest ratio was in pregnant women, 12.5 million cases, 2,000 encephalitis cases, 11 to 50 abortions, 2100 neonatal deaths, 11600 deaths, 3580 blind, 1800 mentally retarded. And these are some pictures of patient infected from rubella virus, Fusher spotters, and this is the child affected from the mother during pregnancy and affected child.